Good afternoon, and I want to thank each of you for being here today. Congressman, thank you for your presence. Over the past 24 hours, I've been in very close contact with the director of the CDC, Dr. Tom Frieden, as well as all the appropriate Texas state health officials. We're working very closely with the local, both the city and the county health officials as well in this very serious case as we partner. As you know, a patient was admitted to this hospital on September the 28th, subsequently tested positive for Ebola. Today we learned that some school-aged children have been identified as having had contact with the patient and are now being monitored at home for any signs of the disease. I know that parents are being extremely concerned about that development, but let me assure these children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms. I have full confidence in the medical professionals, in Superintendent Miles, in our local, our state, and our federal partners in keeping this contained. This is a disease that is not airborne and is substantially more difficult to contract than the common cold. We have experts here with us today who will be talking to you in a minute about the precautions that you may want to take. The medical community of North Texas, along with officials from the state and federal government, have been working together to take every step available and necessary to care for this patient's health and to ensure the safety and welfare of our citizens. There are few places in the world better equipped to meet the challenge that is posed in this case. Texas is one of only 13 states certified by the CDC to conduct diagnostic Ebola testing. And we have the healthcare professionals and the institutions that are second to none. The public should have every confidence that the highly trained professionals involved here will succeed in this very important mission. Public health investigators from Dallas County and from the Texas Department of State Health Services are working to identify, to locate, and monitor the health of all of those who have come into close contact with the patient. The highly qualified men and women of Texas Health Presbyterian are doing everything in their power to deliver the very best care for this patient. They have been and they will continue to be in close contact with federal, state, and local officials to ensure the public safety. This case is serious. Rest assured that our system is working as it should. Professionals on every level of the chain of command know what to do to minimize this potential risk to the people of Texas and of this country for that matter. I'd like to ask Dr. David Lakey, he is the head of our state health services, to come and share with you the efforts that are ongoing as we address this issue. David?
Yes, sir. Well, good morning, everyone. My name is David Lakey. I'm the Commissioner of the Texas Department of State Health Services, and I really appreciate you being here today. I want to echo several of the comments that were made by the governor. First, our thoughts and prayers are really with the family. They were notified about their loved one having Ebola yesterday. Obviously, is a scary diagnosis, and so our thoughts and prayers are with them right now, and also with the treatment team, those individuals in the healthcare that are caring for the individual right now. Since the outbreak of Ebola in West Africa, Texas has been taking steps to make sure that we are prepared for an event like this. A lot of education has taken place. A lot of protocols have been put in place. We've developed the ability to test for this virus since August, and to be able to do that in our laboratory. And that preparedness is not just taking place at the state level, preparedness was taking place here at the local level in this hospital. They took it really seriously. They've been educating their staff. They've been putting their own protocols in place so that they were ready to care for any individual that showed up with Ebola. So we've been on the lookout for this. I had the opportunity today to spend time with the team and talk to the management team and hear how they have been preparing for a long time for this event. And then I had the opportunity to talk to the infection control practitioners and actually go onto the ward and see firsthand the work that they're doing. And I want to let you know they're doing a great job. They're providing compassionate care. They have a committed staff that are providing top-notch care and are doing that in a safe environment. They have a whole ward that's dedicated to the care of this individual. They have a whole team of, again, professionals that are very competent caring for this individual and are doing it, as I noted, in a very safe, compassionate environment, providing excellent care. Now, obviously, this disease is scary to a large number of individuals, but I think some of the points that Dr. Frieden emphasized yesterday need to be restated. One of those statements that he said, and I want to reiterate, is that people cannot transmit this disease until they have symptoms. Okay? And so individuals that do not have symptoms are not going to transmit this disease to individuals. That chance of them transmitting it is zero. This virus is not transmitted by the air. It's not transmitted by the water. It is transmitted by direct contact with an individual, with their skin, or contact with blood or secretions or other bodily fluids. Or if there was a contaminated needle, then you could transmit this. But it's not going to be transmitted, again, through the air, through the casual contact with other individuals. I also want to make the case that this is not West Africa. This is a very sophisticated city, a very sophisticated hospital, and the dynamics are so significantly different than they are in East Africa, or excuse me, in West Africa, that the chances of it being spread are very, very, very small. And again, unless somebody has symptoms, it's not going to be spread to another individual. Our laboratory has been developing the ability to do this test. Since August, we've done the proficiency tests and have that ability to do that diagnostic test in our laboratory, and that ability is available to support the state of Texas. We do a rapid diagnostic test, a polymerase chain reaction, and again, the test yesterday, the controls worked as they were appropriately supposed to work, and the test was obviously positive. We take great care in our laboratory to inactivate the virus and to make sure that, again, our laboratory folks are safe, and it was done in a very safe manner. And we have a biothreat team that is specifically trained to handle these high-risk specimens. So a lot of work is taking place right now. A lot of investigation is taking place, identifying individuals, that the family has been identified, contact has been made, messages have been conveyed to them about how do we need to approach the situation. And we will continue to work very closely with our federal partners at the CDC, our local partners with the Dallas County Health Department, with this hospital, with the Dallas city government, mayor and judge, thank you for being here today, and with the full support of the state of Texas to make sure that we protect Texans and that we provide the care that needs to be provided. Thank you.
David, thank you. And let me add to that, Mayor Rollins and to Judge Jenkins, thank you both. This is all hands on deck. We understand that, and we've got great local partners, and everyone has their marching orders and understand the importance of that good collaboration, that good partnering from the state right through our federal partners with the CDC. So with that, we'll open it up to those of you in the media for any questions, and individuals on the podium here can respond. I beg your pardon? Sorry. Mark, why don't you?
We're categorizing his condition as serious but stable. A checklist was in place for Ebola in this hospital for several weeks, and Dr. Ed Goodman, to my right, had led the implementation of that. That checklist was utilized by the nurse who did ask that question. That nurse was part of a care team, and it was a complex care team taking care of him in the emergency department. Regretfully, that information was not fully communicated throughout the full team. And as a result, the full import of that information wasn't factored into the clinical decision making. The overall clinical presentation was not typical at that time yet for Ebola. So as the team assessed him, they felt clinically it was a low-grade common viral disease. That was the presentation. He volunteered that he had traveled from Africa in response to the nurse operating the checklist and asking that question. I can't answer that question because that's one piece of information that would be factored into the entire clinical picture. The clinicians did not factor it in, so it was not part of their decision making. That's a question that's really not in my domain. We are carefully assessing that now, and that is being investigated. So we are investigating it. I can't give you specific information, but we will look very carefully at that.
Would you not call that a misstep? Would you not?
I would call that not factoring all the information among the team that was present, so that all the information wasn't present as they made their clinical decision. That information was not obtained when the patient was in the emergency room. Oh, I'm Dr. Mark Lester, and I'm an executive vice president with Texas Health Resources. I'm the zone clinical leader for the Southeast Zone in Texas Health Resources. Well, remember, it's unprotected exposure to the bodily fluids that constitutes an exposure. And so very carefully, and together with the CDC, we're investigating how many people that might be and how they might be monitored if that's so.
Does that mean nothing?
As I said, we're investigating that right now. Dr. Lakey.
Again, my name is David Lakey, the Commissioner of the Department of State Health Services. We're working very closely with the local health department on this. The local health department identified individuals starting on Monday. They have conveyed information related to how this disease can be spread and the need to have ongoing monitoring. They will be in daily contact with the family. If they do not follow those advices, that advice, then additional steps can be taken. But right now, we're working with the family to ensure that they do as we are advising them related to the spread of the disease. Zachary, you want to talk?
Well, I just want to concur with Dr. Leahy said that we are working with the CDC. We have identified those family members, and we will, Dallas County, along with County Judge Jenkins, we will take responsibility for monitoring these families, and our staff will be responsible for ensuring that they do not get out into the public. So that's a task that we're taking on, and we support Presbyterian Hospital, the governor, and Dr. Leahy, and the CDC in this response. Well, we want to make sure it's clear. It's going to be monitored by our staff. As Dr. Leahy pointed out, if they don't follow our recommendation, more stringent guidelines will be put in place, and that's something we need to discuss in a more legal aspect.
So all the information says that the patient did not have any symptoms, and actually, not until many days after his arrival did he start having any symptoms of fever, et cetera. That is from him. He had screening before he got on the airplane. There was no screening. You don't screen afterwards. There isn't additional information besides the information that we got from the individual. Dr. Goodman, did you? Mm-hmm. The hospital's looking at that right now. They're looking at they've identified the individuals that had contact with the patient, identifying what that contact was. Just because they were in the emergency room doesn't mean that they had contact with the individual. Discussions are taking place with those individuals to see what kind of personal protective equipment they used in that when they were evaluating those individuals, and so all that is being discussed right now, and that's why the CDC. Does anybody from the? Huh?
I'm Dr. Edward Goodman. I'm the hospital epidemiologist. I'm an infectious disease specialist by background and training. Let me emphasize that when the patient arrived on Sunday, the 28th of September, he was recognized as a possible case. He was placed in the appropriate isolation. So there was no further exposures from Sunday morning on. Exposure is not the same. Contact and exposure are not the same. The people were wearing appropriate personal protective equipment. The questioning of the healthcare workers who saw him 2 days earlier started before we were proven to be, before it was proven to be Ebola. So those questions have been ongoing. Since his arrival on Friday, he was not vomiting or having diarrhea, and therefore there was no exposures. So we really think there is very little likelihood that any healthcare worker was exposed on Friday, and certainly virtually zero exposure starting Sunday. Just fever and some abdominal pain. The test for Ebola virus that is used is a highly sensitive measurement of virus in the blood. As Dr. Leahy pointed out, it's called polymerase chain reaction. In the first 3 to 4 days of symptoms, the level of viremia is quite low, and the test is not always positive. But in the case of a patient who's been sick by the time we saw him for probably 5 or 6 days, the test should be essentially 100% accurate. I'm sorry, we didn't have those conversations. Oh, yes, thank you.
Thank you, Dr. Goodman.
I can't answer your questions.
We did not discuss that specific question. What we did talk about was that the CDC has the largest stand-up outside of the United States in their history. I think some 130 CDC personnel that are in Africa now. Yeah, obviously, we have a very large contingent of our military there. And again, I think this goes to the heart of finding the solution to this issue, both globally and for the United States, is for our participation in that, the United States engagement in that, and for us to assist those countries in Africa. With that said, I'm very confident that what is ongoing now, what Mayor Rollins and Judge Jenkins and their team are engaged with here, both on the private sector side and then what Dr. Goodman and the folks at Presby are engaged with in the treatment of this patient and of the protection, the isolation, the appropriate effect of our healthcare professionals. There is no place in the world, I will suggest to you, that has better professionals, better ability to address this than in Texas. We wish it were somewhere else, but the fact is it's here, and we have an extraordinary team of men and women passionately and compassionately delivering care to this individual and doing everything possible to make sure that the citizens of the state are fully protected from this virus. I'm confident that the work that they're doing is appropriate, and we will keep our citizens as safe as possible. Thank you all for coming and being with us.